Hi everyone, hope you're doing well today. Thought I'd actually show my face. I had to go somewhere this morning, so I don't have work from home clothes on today. Kind of, obviously. I've worked from home hair, but so I just wanted to go over a couple things from last week. Everyone did really well on the quiz, so there's not much to go over there, but I'll go over a few questions and get you prepared for next week. So we're in week 7 now, which is our last full week of the class, meaning that it goes from today, Monday, through to Sunday. In week 8, it runs from Monday to Friday, and all assignments need to be submitted by Friday at midnight. So please keep that in mind. You don't have the weekend to complete your work next week, and next week is our final exam. So outside of that, the work is pretty limited. It's just a short medical terminology exercise, so not too difficult, but and some discussion. Obviously, we always have that, but so keep that in mind. Friday night, midnight, things need to be in. If for some reason, if you have busy work week or whatever, you're unable to get to it, please let me know. I'm sure we can work something out. I just need to know in advance. So last week, week 6, we talked about operations a bit, but also quality improvement, process improvement. As I've mentioned last week, if you have a specific interest in quality, to the two full-time faculty in the program, Dr. Frendak and Dr. Hampy are both former patient safety officers. So you'll get a lot of education from them, both in classes that you take with them that are not related to quality, because they do tend to relate a lot of their examples to when they were in quality, as well as the quality classes themselves. Um, so we also had last week written assignment. I have not looked at that yet, but I will. We had our quiz, like I said, that folks did well on. We had our discussion, and for the discussion, that's a tough discussion. I think I mentioned it last week in the Ed Puzzle as well, but just make sure that you are, when you're doing a discussion, if you have a question about it, please feel free to reach out. If you're doing your discussion last minute on Wednesday night, which a lot of people do, please, just reach out if you have a question. Don't feel that you have to get it posted and then perhaps get something wrong or whatever. I am pretty flexible, and I think you'll probably see me again if you're in either the major or the minor. I'm pretty flexible as long as I know. And knowing is really the most important part. But as long as I know what's going on, I can be flexible with things within reason. I can't give you an extra 3 days every week to do stuff, but if you have a question and you're sending it Wednesday night at 9 o'clock, I'm not likely to answer it then. I'll probably answer it on Thursday, but I can certainly give you some latitude to wait to do the question until you get some feedback from me. So just be aware of that. So we had the discussion, and with this particular discussion, think about any organization or any decision that an organization makes. So, for example, if you're in the HR department, and I think I had listed this as an example for somebody that had a question about it, but let's say you're in the HR department and the decision is made with the VP of HR and the other folks that are in higher positions in HR and in the organization. The decision is made that everyone has to be vaccinated, which is a decision that many, if not most, healthcare organizations are making. We need to make sure that our patients are safe. And folks that are working in the facility are safe. So we need that on both sides. So let's say you make that decision, people need to be vaccinated, and you have a cutoff deadline, giving folks plenty of time to get their vaccinations. What they don't realize is there are people that won't get a vaccination. They don't believe in the vaccination. They feel that, they've received some misinformation that, COVID doesn't exist, or that, they feel the vaccine is dangerous or whatever it might be. As all of us know, there's a lot of misinformation out there about vaccines, about COVID, about what is safe and what isn't safe. So in that way, HR is impacted because now we have 350 jobs that are gone. People are gone in those roles. So that's the type of decision that, the VP of HR and the C-suite folks may make the decision, okay, we're going to require it, but they're not realizing the impact. And all you need to do to understand that, and I live in a tourist town, so it's a big thing here, but if you're trying to fly anywhere this week on Southwest Airlines, you may have seen it in the news or on Twitter. thousands of flights being canceled because pilots and other folks that work with flight crew folks are kind of doing like a silent strike because they are refusing to get vaccinated, and they put a requirement in place that they had to be. So, thousands of flights canceled across the country yesterday, 500 flights the day before. So obviously this impacts that same kind of thing with an organization like an airline. That decision that was made to require vaccination was probably made in kind of a bubble, not realizing that there were so many folks that are critical to their operations that would refuse or would refuse in protest. They would protest on behalf of others that maybe were refusing. Maybe those folks are vaccinated, but they're not showing up to work because they, are in allegiance with others. So that impacts that impacts lots of people, not just folks in the positions, folks that are coming to work or in position without appropriate help, without the ability to do their job effectively. But then obviously all of the tons and tons of people, probably hundreds of thousands of people that have had their plans mislaid. Could just be a vacation, or could be getting home from a vacation, or a business trip, or a trip for a family event, or something like that. So lots of complexity in decision making. And so with our question, we were talking about effectiveness, efficiency, cost, and patient-centeredness. So think about that Southwest decision. Their decision not to come to work affects their client, just like, if nurses did the same thing and chose not to come to work, that's going to affect the patient. So, same type of thing. And obviously effectiveness, efficiency, and cost. Those types of decisions really impact everybody, not even just folks within the organization, but outside of that. Unfortunately, many times healthcare organizations do work in a very siloed environment. So folks in the C-suite aren't talking to the folks that are actually doing the work, so that disconnect creates bad situations. The hope is that as more and more folks that are learning more about the importance of teamwork, as those folks get into those higher positions in healthcare. But 40 years ago, when some of the folks that are now CEOs, when they started in their careers, that's how it was. Everybody was their own silo. But you can't operate that way anymore. So the hope is that when you guys get in there, when folks even my age, I'm not that old. So even folks my age get into those C-suite roles and those top positions, that it will be, um, it'll be able to go forward and fix those problems. Week 7. So this week we're talking about kind of my realm, and we talked a little bit about it before with law and ethics. Now we're talking about the other side of my realm, financial management, economics. And we talked about insurance and reimbursement, healthcare spending, those types of things. And I guess the real key here is think about how much things cost. Think about the fact that with COVID, the federal government had to put billions of dollars towards treatment for patients that are uninsured, because you can't just leave folks dying of an infectious disease on the street. They do that with other things, unfortunately, but you can, with an infectious disease, they dedicated billions of dollars toward treatment, care and treatment of folks with COVID, keeping them safe and healthy as best needed. And even look at the vaccines. You're not seeing everyone get flu vaccines for free unless you have insurance. So it's interesting that with COVID, it's just like, here's all the vaccines. You'll get a bill for your administration, unfortunately, in some instances, but generally it's been a free exercise. So just think about that. Think about the problems within the industry with regard to finance, people going bankrupt, medical bankruptcies because of massive bills. I myself, I have to have an MRI. I called to schedule the MRI. The company refused to. They refused to approve it, my insurance company, and they said, "Oh, it'll only be $850 if you'd like to have it done." Well, I don't have $850 lying around to spend on an MRI. I might spend it on something else, but not on an MRI. So that's where it's really key that we understand the problems related to medical bankruptcy and whatnot. We also have an individual case study this week that's in your textbook. So this one's done. It's not a group case study like we've seen before. This one's done on your own. And then also our quiz and our Ed puzzle, which will you'll this so you'll see it when it's ready. So week 7, just a few questions. Like I said, everyone did really well in the quiz. First question: definition of quality provided by the IOM, or Institute of Medicine, is the most widely accepted definition of healthcare quality. Which of the following are not parts of that definition? So the answer is A, which is they should provide value consistent with the cost structure of the healthcare organization. The key is we always want to provide the greatest value to our patients. And even if you are an organization that maybe doesn't have a lot of money, charges folks less because maybe you're in a rural area, etc., those folks should get really great care as well. We're expecting that across the continuum, everyone gets the same level of care regardless of how much they're paying. So just like when we go to a store and you say, okay, actually I did this earlier, I went to the store and there were 2 types of enchilada sauce that I was looking at, and one was $2.99 and one was $4.99, and I'm like, oh, the one that's $4.99 must be better. It costs more, so I bought that one. Same thing here. Like you can't say, oh well, the free clinic, it's okay if they provide terrible care, it's free. No, we need everyone to provide great care. So it's not that. That cost structure notion can have no realm within the quality systems. We need to make sure we're always providing great quality care to our patients. Avitas Donabedian defined healthcare quality, obviously one of the godfathers of healthcare quality, as having which of the following components. So not necessarily quality of nursing education or social management of health and illness, but the ethical principles that govern affairs in general and the healthcare enterprise specifically. So what they were saying is, the root of providing good quality care is being ethical in our actions, and that is exactly what we expect our providers to do. Our clinical staff, our providers, everyone involved in the care of the patient, we expect them to act in an ethical manner, and by doing that, they will always be providing the best care they are able to provide. So that's our answer there. I think this is the last one. The term effectiveness of clinical care can be addressed with which of the following questions? So our answer is, are the right things done? So that is really the root of, and this is a good example. So the MRI that I have, the reason that they are denying my MRI is that I had a CT scan at the emergency room probably 4 weeks ago now, and so my insurance says, well, the CT is good enough. Well, my neurosurgeon says, no, the CT is not good enough, and then I need an MRI to make a determination. Does she need surgery? Can I do injections? Can I do other types of things? So the notion of doing the right thing is what effectiveness of clinical care is. If you're just doing things, you might not be effective. Looking at the right things to do is great, but if you don't do them, then it's not effective. And was the clinical procedure done correctly? Again, that's great. You want things to be done correctly, but what if it wasn't the right thing? So you need to do the right thing at the right time for the patient, and that's really that's the key of effectiveness of clinical care. Okay, so that's all I've got. I apologize, a little wordy today, but remember, this is our last full week, done on Sunday, as always. Next week, week 7 is, look at my calendar here, the 18th to the 22nd. Remember, the 22nd is the last day of the term. Your work needs to be in by then. For week 8, obviously you have a full week here, full 7-day week. And any questions on anything, as always, please reach out and let me know. Okay, thanks so much.